our eyes are made for distance vision, right? Which is that
Yes.
we have humanized the world, so we require books and we read. So we is it true that monofocal lenses, which give us very good vision for distance, but we require glasses for reading? Is the ideal lens gives us very good quality of vision, but our world right now has become a bit limited to 80
True.
centimeters or 90 centimeters around. Why? Because even if you're driving,
Yeah.
you're not looking at the car, you're looking at Google
Yeah.
Maps. Right?
True.
You're looking at your dashboard more than the distance. So that intermediate vision is very, very
Yeah.
important, which we don't
Yeah.
understand.
Yeah.
So that's why even though these advanced lenses are giving us good vision for intermediate and near, but they come with certain amount of, I would say, trade-off.
Yes,
What do you
that's
say?
the correct word. So,
Yes?
to be honest, like I said, I think it depends on the lifestyle of a patient.
Okay.
There are a lot of patients who come today. So recently, we had to operate on a young boy who was a shooter. He was a professional shooter, and he's a 30-year-old chap. Obviously, has not got presbyopia. He doesn't
Yeah.
need reading glasses, and he's got a cataract which we then need to operate. Now imagine removing a lens. I mean, I felt so sad because I was removing a lens, a natural lens, which was giving him great vision for
Yeah.
near, but he was finding it difficult because he needs to look through a small pinhole to shoot. And that was, he had a small PSC right in the center. So he's not able to look
So you
at
got a
his
cataract
target
right in the
right
center.
in the center. And that's exactly coming in his visual axis. And what do you give to this patient? If you give him a trifocal or obviously because the other eye doesn't have cataract and he
Yeah.
will need something for reading,
You'll have an imbalance.
he will have an imbalance if you just give him for something for distance. But we had a conversation with him. We tried to understand what his needs were. And for him, that distance crisp vision was the way to go.
important.
So
Yeah.
for him, we
Makes
did
sense.
not choose a trifocal lens. We went for an EDOF lens, which will give him some semblance of an intermediate, and his other eye would obviously help him for near. But I think in these certain things, a monofocal or an EDOF lens definitely
Works better.
scores because it will give the promised distance vision well,
Yes.
as long as the patient is happy wearing glasses.
Yes. So it's supposed to be discussed with the patient prior
Yes.
so that the patient knows what
Yes.
to expect. Right? Because we've seen cases where a patient is given a certain type of lens, but the outcome was different to what the patient expected. Why? Because the patient goes into the cataract surgery having vision
Certain
for distance
expectations
and
also.
for near vision and having certain expectations. But once they are not met, and once he knows now it is irreversible,
Yeah.
that's when the patient tends to be unhappy.
True.
So it's like you rightly said, that it is a very tailored approach
True.
for lenses. Okay, so I also want to. So I had this. It's not leaving my head the idea of children having cataract.
Yes.
So if let's say a child is undergoing a cataract surgery, of course, it's the parent that you're going to talk to, not the child. The child
Yeah.
is not really knowing
Yeah.
what's going to happen.
Yeah.
So how do you manage the expectations of the parent and you tell? Because of course, I'm sure there must be certain nuances about putting a lens inside the eye of a child because the
Yeah.
size might be
Yeah,
different.
true. So again, it depends on the age at which that cataract has come up and the
Yeah.
patient has gotten operated. There are a lot of dictums being followed. But if it is a child who is less than 1 year of age, we tend to wait until he is 1 year, and then sometimes the child may even require a second operation, wherein then the lens is implanted at
later.
that age. Yes. But whatever may be the situation, whether the lens was put initially or not, the next most important obstacle, I would say, or the hurdle that the parents need to cross is to stimulate that eye.
Okay.
So imagine that the eye can't see. So if it's just one eye, the patient may have cataract, that eye is not able to see. Or rather, the patient is only able to see something as close to this distance.
Yes.
And if that is the situation, and if it gets ignored, that eye is going to become lazy. And that crucial or a sensitive time for every child's life, which is up till 11 years of age, if that gets ignored or lost, that vision to come back is extremely difficult. So for most parents, they need to stimulate the eye, and there are many ways to do that. So simple thing like patching the good eye and trying to stimulate the other eye is one that they can try. There are a lot of therapies available today. So they can go to an ophthalmologist. They will give them amblyopia therapy. And that kind of exercises or some games that are shown on a computer which may,
help improve
excite
the
the child.
vision.
Yeah.
Yes.
So all of these things are available today. So there is no excuse for anybody to kind of ignore a lazy eye, because when you've if you've ignored those initial few years, you've lost on that important time. So I would say at this point, it is important to educate parents that the first checkup for any child needs to be done at age 3. The child can't read at that time, but we are equipped to kind of figure out if there's a power in the eye or not. The next needs to be done at age 5, because by then the child is able to recognize maybe few objects, or they can call a house, they can talk. So that is the next checkup that needs to be done. And then after that, depending on what the eye status is, if he has number or not, continue to do a yearly checkup.
Okay, that's interesting. Also, Dr. Tanvi, coming on to, when you talk to a patient who is about to undergo a cataract surgery, very common question is, Doctor साहब कोई complication, कोई problem तो नहीं आएगी. So how do you counsel your patient? Because we know that every surgery does have a sort of complication. There is no surgery without complications.
Yeah.
So what do you tell your patients about surgery?
A little off. This is not something I tell every patient, but when a third time the patient asks me, कुछ होगा तो नहीं, then I tell them कि आप यहाँ से वहाँ cross करने road जब जाओगे, आपको कुछ होगा तो नहीं. So it's not like that, but at the same time I tell them that we are skilled enough to take care of any complication if at all it happens, because it is we know the parameters of the eye. We know if this cataract is there, what needs to be done. We have trained ourselves for so many years to be able to handle that well. So if at all, God forbid, something does happen, we also know how to solve it.
Right.
But if it's a regular cataract, we know that the outcome is going to be good. So we do reassure the patient. And before the surgery, we have taken those steps. We have done all those tests. We've looked at the lens. We've looked at the retina. We've made sure the pressures are fine. So we've looked at those. Due diligence is done so that we know that the patient will get a good outcome.
So simply put, a patient should understand that yes, surgery is a surgery. Even a cataract surgery is even the most simplest way, because I think it's one of the most commonly performed surgery in the world, because we have double the number of eyes than the population.
And the surgeons.
And the surgeons. So of course, if a complication does occur, we are equipped to manage them very well. So there is no loss of vision.
Yes, very rarely. Yeah.
So let me go into a darker zone, and of course you must have had complications. Everybody does. Even I have had, and everybody, even the best, they happen to the best. So when a complication does occur, is it equally hard on a surgeon?
Oh, I think
of course,
it's more
for a patient,
hard
of
on the
course, there is
surgeon.
no excuse. A complication is a complication. But what goes through a surgeon's mind?
So I wouldn't be able to answer that for others, but
Yes, for
personally,
yourself,
let me tell you the story of the first complication that I had, and it was the
please.
disastrous one ever. So I was actually traveling from one hospital to the charitable hospital with my mentor in the car. And I remember we were just discussing, the different types of surgeries, and I just asked him, so what may happen if I get a nucleus drop?
So for nucleus drop is basically when the cataract kind of falls inside the eye.
At the back of into the vitreous. And so he obviously told me what has to be done and all of that. And this is on the way to the hospital, and the patient that I take up, within a second, it was a hypermature, very, pseudo-exfoliation, dense cataract, all the complications, weak back. The minute I went in with the phaco probe, it dropped.
There was a complication.
So I think that thing taught me two things, very importantly, is again something I feel most aspiring or budding surgeons should remember, is that if you get a negative thought in your mind, so I was talking about what if I get a nucleus drop, and exactly that's what happened. If you do get a negative thought in your mind, and it's very easy to get one, right, as a beginner surgeon, it is important to replace it with a positive one. That we will be able to manage it. We'll do something about it. Or it won't happen. I mean, it may sound very naive, but if you say that, I feel that a lot of things, because you have trained yourself, right? You are skilled to do it.
Yes.
You should not let your anxieties take over.
Right.
And obviously at that time, fortunately for me, my mentor was right beside, and he took over. He, the case was all okay. So,
So it turned out fine, right?
It turned out absolutely fine.
It was the most disastrous complication, but it turned out fine because we were equipped to manage
it.
Actually, I tell my patients when they ask about complications, it's of course, if I am going for my surgery to a surgeon, I will of course place my trust in him. It is the same thing like you're probably traveling on a flight at night. Right? So you're on a plane, you're with a pilot who you don't know. You're in a plane and with strangers, and you can't see.
Correct.
But of course, you sleep.
You exactly.
You sleep on the plane, so of course you
Yeah.
place your trust on to God
Yeah.
and to
Onto
the pilot.
Correct.
And things usually and most of the time turn out well.
Yeah. Yeah.
Yes. So डॉक्टर तन्वी हमने डिस्कस किया हमारे कॉम्प्लिकेशंस की कैटरैक्ट में क्या कॉम्प्लिकेशंस हो सकते हैं एंड हाउ यू लर्नड कैटरैक्ट सर्जरी. आपकी स्टोरी क्या थी, आपके फर्स्ट कैटरैक्ट की, आपके फर्स्ट कॉम्प्लिकेशन की. अब आप जूनियर्स को ट्रेन कर रहे हो. Every junior, of course, every cataract surgeon has this journey. First
Correct.
case, first complication, and then first success. So, आपके माइंड में क्या होता है ट्रेन करते करते? Do you learn from your mistakes?
So, जब अभी हमारे पास हर जन को हर दिन एक अलग अलग सर्जन ट्रेन करता है. जिस दिन मेरे वो पास आता है सर्जन, सो आई थिंक सबसे पहले हम ये चीज़ कभी नहीं देखते हैं, बट ये देखना बहुत ज़रूरी है कि वो पेशेंट के साथ बैठ कैसे रहा है. सो इफ़ यू नो, हम लेटाते हैं पेशेंट को एंड देन द सर्जन सिट्स ऑन वन साइड. अब वो जो शुरू तो कर रहा है एज अ सर्जन, ऑब्वियसली थोड़े डिफ़िकल्टीज रहते हैं. हम किस तरह से वो पकड़ रहे हैं प्रोब को, किस तरह से एंटर कर रहे हैं. हम सब चीज़ माइक्रोस्कोप से देख रहे हैं. सो हमें वो सिर्फ आँख दिखाई दे रही है, आँख अंदर जाने वाले इंस्ट्रूमेंट्स दिखाई दे रहे हैं. ये नहीं दिख रहा कि वो बैठा ऐसा है या सीधा है या उसका हाथ ऊपर है या हाथ नीचे है. एंड ये सारी छोटी छोटी जो चीज़ें हैं वो बहुत मायने देती है. एंड ये मुझे अभी महसूस होने लगा है व्हेन आई हैव स्टार्टेड ट्रेनिंग देम, इज़ दैट दे हैव स्टार्टेड डूइंग द सर्जरी एंड दे आर नॉट डूइंग इट करेक्टली. अगर मैं उनको कहूँ ऐसे नहीं ऐसे करिए, दे आर नॉट एबल टू डू इट. एंड आई रियलाइज इट ओवर टाइम इज़ बिकॉज दे वॉन्ट एबल टू फिगर इट आउट, बिकॉज उनकी आँख देख रही है वो, बट उनको समझ में ही नहीं आ रहा मैं करूँ क्या. सो नाउ व्हाट वी हैव स्टार्टेड डूइंग इज़ कि हम बाहर से उनको दिखाते हैं. सो हम रिकॉर्ड कर रहे हैं उनके हाथों को, उनके बॉडी को, एंड वी आर ट्राइंग टू शो देम कि आपने अगर आपका हाथ इस तरीके से रखा तो शायद अंदर का चीज़ आपका वो चेंज होता है. एंड इट मेक्स अ ह्यूज डिफरेंस. So that's something that we have started doing.
अभी रिसेंटली एक स्टडी हुई थी
Is
कि
it?
हैंड आई कोऑर्डिनेशन का इम्पोर्टेंस क्या है सर्जन्स के लिए.
Yes.
एंड जो लोग बचपन में ज़्यादा वीडियो गेम्स खेलते हैं
अच्छा.
उनका हैंड आई कोऑर्डिनेशन बेटर हो जाता
I
है.
wanted to say because मैं वो करती थी.
मैं भी करता था.
हाँ, वीडियो गेम्स नहीं. मैं बहुत सारा निटिंग करती थी और क्रोशे करती थी. सो उसमें दोनों हाथों का उपयोग होता है. एंड ये मैं हर जन जो मेरे यहाँ अभी आ रहा है एज अ ट्रेनर, एज अ ट्रेनी, उसको कहती हूँ कि तुम कुछ तो करो जिससे आपका लेफ्ट हैंड स्टिमुलेट हो. बिकॉज एज यू नो हमारे सर्जरी में लेफ्ट हाथ से बहुत कुछ डिटेलिंग हमें करना पड़ता है एंड दैट इज काइंड ऑफ अ मेक और ब्रेक फॉर द सर्जरी. और बहुत लोगों का लेफ्ट हैंड डोमिनेंट नहीं रहता और दे आर नॉट यूज्ड टू इट. सो आइदर सुबह ब्रश करना शुरू कर दो लेफ्ट हैंड से, या यू नो कुछ तो करो ताकि ये थोड़ा सा स्टिमुलेट हो.
एक चीज़ जो शायद नॉन ऑप्थेल्मोलॉजिस्ट को ना पता हो कि इस कैटरैक्ट सर्जरी करने में हमें 2 हाथ
और एक
दो पैर एंड
दो
अपनी
आँख.
वॉइस का इस्तेमाल करना है एंड आंखों से हमें देखना है माइक्रोस्कोप के अंदर.
दैट्स राइट.
जो हमारी आंख का साइज है बहुत छोटा है.
Yes.
हम माइक्रोस्कोप में उसको 4 to 5
Yes.
टाइम्स मल्टीप्लाई और मैग्नीफाई करके
Correct,
देखते हैं.
correct.
हमारी एक हाथ में एक मशीन है, दूसरे हाथ में दूसरा इंस्ट्रूमेंट है, एक पैर में एक इंस्ट्रूमेंट चल रहा है, दूसरे पैर में दूसरा चल रहा है, जिससे हम माइक्रोस्कोप को हम
Absolutely.
कंट्रोल करते हैं.
जब तक आपने नहीं कहा मैंने भी ये आई रियली डिडंट थिंक कि वी आर लिटरली यूजिंग एवरी सेंस.
Yes, every sense, and we are looking into the microscope,
Yes.
and we are also talking to the patient, क्योंकि हमने अपने पेशेंट को कोई इंजेक्शन नहीं दिया. हम पेशेंट को बस ड्रॉप डालते हैं, उससे आंख सुन हो जाती है.
True.
So basically, it is requires that ambidexterity.
Yes,
right?
ambidextrous
So,
हो तो
ambidextrous
सब
हो तो सब कुछ ठीक है. That's why playing video games as a child can actually help.
But
Which
I don't
goes
want every
against-
children to go and play video games.
Okay, yes.